I will preface this by saying I'm kind of dealing with a respiratory something, so I'm going to hope that I don't cough too much. I have my water. And as I was walking in here today, I felt very blessed because I really did not believe that I would get back to the stage because of some really tremendous personal things that happened in my life. And so this talk is the first time I will share with you not only my science, but my story. And the goal is to educate and also inspire. So I'm going to introduce you to my primary company, which is Valtari Bio, and a new initiative that I have recently created, which is my company number 2, which I call Deep Roots Healing. And then finally leave you primarily with this notion of living a legacy. And I think this is something that we don't talk a lot about as nurse scientists, something we just kind of take for granted and we look back. And when I first started in my career, I was really surrounded by fantastic mentors who said, create your legacy now, think about what you want to leave, and take the steps today to do that. So I'm really talking to those of you in the room who are trainees, who are young, who are new, who are starting out, to really allow that to be the foundation of your career. So my story, I'm from West Virginia, born and raised, and we like to tell stories in West Virginia. Story is a way that we educate one another. It's also a way that we heal. It's also a way that we inspire. So when I thought about pulling together this presentation today, I was really drawn to this aspect of storytelling because so much of what I do is I tell stories. I like to talk with my hands too. This is a picture of me in the first lab at West Virginia University School of Nursing. So I was the first nurse at WVU, assistant professor, to be given a laboratory space in our Center for Neuroscience. So that was a huge accomplishment, not just for me, but for the school and the university. So I'm really proud of that. And then, of course, I cannot give a talk without talking about my family, my husband and my beautiful 4 children who have supported me, supported me throughout all of these moves. And I want to just preface, when I talk about my science and I talk about my work, I've recently been talking about it before a specific event that occurred and then after a specific event that occurred. And so I know each of you have these moments in your career or in your life where you say, wow, this is gonna look really different now. This is changing who I am. It's changing who I want to be as a scientist. And now I'm going to create that moving forward. And I'm going to ask all of you to be thinking about those defining moments as I talk to you about mine. So my very first defining moment as it relates to my career was getting the phone call from Mindy Tinkle when I was on the unit at the University of Pittsburgh. I was a nurse, I was a bedside nurse. I answered, I never got phone calls on the unit, so I thought for sure something was wrong. Answered, it was Mindy, and she said, Tara, you're in. You made it to NACNR. And in that moment, I remember getting off the phone and going back to see my patient, and I just could not focus on the day's activities because all I could think about was this fantastic opportunity that I was given. And now I'm thinking of moving to Bethesda and making this huge transition. Not only was I the first in my family to go to college, I was now the first in my family to leave my small town of Washington, Pennsylvania, and come to Washington, D.C. I was the first group of NACNR Graduate Partnership Program Fellows. Katie is here with us. Katie was also in that, and Emma and Darlene and Ann, and we were so excited to be here. And it was really a defining moment, I think, for all of us in our career, because not only were we forging a new path here at NACNR in the intramural training program, but we were also forging a new path in our lives and our careers. And that was, I can't say enough about how this program set up my career and really allowed me to see differently and think outside of the box. I was also a Summer Genetics Institute trainee in 2006, and my dissertation at the time, I'll talk to Pam a little bit more, the NACNR GPP looked a lot different when I was in NACNR GPP. I had a dissertation committee. My chair was Yvette Conley, who is sitting here today. I was so excited to see her walk into the room. So I had committee from the University of Pittsburgh. I had committee members from the National Institute of Neurological Diseases and Stroke, and also from the National Institute on Aging. And my dissertation project was really the foundation of looking at immune responses in stroke and understanding the transcriptome as it relates to that acute immune response in stroke. So we actually recruited patients here at Suburban Hospital. We followed patients over time, looked at those different responses. And believe it or not, that project set the stage for my company almost 12 years later. So it really kind of, when I look back at my experience here at NIH, it really did set me up for a fantastic career. It was a foundation that I needed. And it exposed me to this world that allowed me to see my nursing career very differently, as well as my approach to stroke and head injury. So as a very young nurse, when I came to the University of Pittsburgh, I was very driven. I wanted to work with brain injury. I mean, I had some personal experiences in my family, and I said, I want to be a nurse, and I want to work on this problem. And coming to the NIH allowed me to see this problem really differently and to start asking different questions. And I had a year here as a postdoc in the intramural program, and then I took my assistant professorship, moved back home, WVU, and I really started my career based on this foundation I'd created here at NIH. And what I learned from my experience here was there is really no limit to what can be done when you get the right people together and you give those people resources to get the job done. And I've taken that with me all along my career. So everything was going great. I was at WVU 2011, and I was working towards, I had some funding. I was a Robert Wood Johnson Nurse Faculty Scholar. I also had some NIH funding. I was American Heart. I was really, really active in the American Heart Association. I was active in our stroke program. And then life hit me. My defining moment number 2 was riding in the back of an ambulance as a patient. And after over a decade of studying stroke, heart disease, I immediately became that patient that I was working to improve. In February of 2013, I had a pulmonary embolism. I was 12 weeks pregnant. The stress of that pulmonary embolism also caused me to have a heart attack. Then I developed neurocardiogenic syncope, and for those of you who don't know what that essentially, it just means that the brain and the heart were not communicating to one another. Couldn't maintain my blood pressure. I could barely walk around the store, let alone go up and down my stairs at my house. And I just fell apart. I was right in the middle of my career. Things were really active. I had a full-time grant. I had a team of about 20 people. We were doing clinical trials in the emergency room, and here I am, I can't even walk up the stairs of my house. So I was really lost. I had numerous complications. I didn't know where to go, and I was looking at everything from lots of medications to a filter to you name it. Nobody really knew what to do. I was able to come out of that because I took some steps to get the help I needed and created a holistic team of practitioners to allow me to now be medication-free and actually get through this using alternative methods. But it really changed me. And how it changed me, not just personally, but as a scientist, was when I came back to work, I recognized that I didn't want to just be an academic. I really came into this to change the way we think about stroke and head injury. That passion is what really brought me to nursing from the beginning. And I recognized that in my position, I wasn't really doing that. I was just kind of going through the motions, and I was doing everything that quote unquote defined me as a successful scientist, but I was not living my passion and my dream. So the lesson I got out of that was it was a really bad time for me. It was a really difficult time, but it actually led to one of my best times, because out of that, I created Valtari Bio. So I came back to work at WVU. In 2015, brought together a team where we co-founded Valtari Bio. I actually was working full-time at the university for a period of time and then doing this on the side. And then 2 years ago, left my post. I was up for tenure. I actually had a lot of people say, are you crazy? You're gonna make it, and now you're leaving. I left my post at WVU. We had no money in Valtari, but I said, we're gonna figure out how we're gonna do this full-time in the company, and we were able to raise our money to continue. We licensed the intellectual property that I developed as a graduate student here at the NIH, as well as some intellectual property I created when I was at WVU. And I now serve as the Chief Science Officer and the Chair of the Scientific Advisory Board. And our mission at Valtari Bio is to create a future personalized medicine for stroke and head injury. And this passion hasn't changed for me. I saw this when I was a young girl. Personally, I saw this whenever I started working as a nurse at the bedside. We really have still this one-size-fits-all approach to stroke and head injury. We've done very well with acute stroke, not so well with stroke recovery. And so our goal at Valtari is to really create this approach. And when we first created the company, we had a few things going on at WVU that kind of helped us think about the different aspects that we could start creating in Valtari. The first was this immune response to stroke that we didn't quite understand. There were some new data popping up to suggest that the immune response in stroke was really critical. I'm not just talking inflammation, I'm talking about the actual immune response. We didn't understand enough about it, and we really didn't understand how that immune response changed over time to guide treatment or recovery. But what we discovered as we were really creating a business was that the first piece of the puzzle that still needed fixed was actually stroke triage. So for those of you in the room, you may not believe this, but when I say stroke triage, what I mean is that immediate decision of a clinician looking at a patient and saying, I think you're having a stroke. We get that wrong up to 60% of the time. And it's worse in rural, underserved areas. These decisions are primarily being made by EMS and paramedics in the pre-hospital setting. We now have 4 different levels of care for stroke, and so if that EMS clinician gets that triage assessment wrong and says, I don't think you're having a stroke, the patient is sent to the wrong hospital, the wrong facility. Time is brain, and we know that triage and transport are critical for stroke cases. So I saw this when I was at WVU working in the stroke center. I mean, one case in particular, I can tell you, there was a woman who was a young woman. Stroke age of onset is decreasing. Patients are more comorbid. They're looking more complex. She was coming in with migraine at an outlying facility, and she was sent home because she had a history of migraines. Unfortunately, that patient came back in about 2 hours, and she was having a bleed that was missed. By the time she got to our facility, it was really too late. And within a period of a few days, the woman had passed away because we had missed that opportunity in the outlying hospital. And I couldn't help but think, if we didn't have some objective way to say, yeah, she's definitely having it, there's something going on with her, get her to the stroke center, if we could not have changed the trajectory of her outcome. So that current diagnostic path, when I explain this, sometimes a lot of folks go straight to this neuroimaging piece, and they say, well, we have CT and neuroimaging. Why are you doing this? I don't understand. We are getting this far before CT and neuroimaging. That subjective determination of whether someone's having a stroke happens on average 30 to 60 minutes before the patient is taken to the CT or imaging scanner. And when you go out into the community or the pre-hospital setting, there is no option for CT or neuroimaging. It's really being made on subjective clinical assessment. And when any of that goes wrong, and we make the wrong triage diagnosis, we know that patients either sit in the ED for a longer period of time, they go to the wrong facility, or treatment isn't initiated when it needs to be initiated. So our solution to the problem is a rapid point-of-care stroke blood test. And this stroke blood test is based on the work that we have done over the last decade. And we have created really an immune-based biomarker multi-analyte algorithmic assay that will give a clinician a high or low likelihood of a stroke diagnosis within minutes from a pinprick volume of blood. So our goal is not only to be in the emergency room, but also in the back of the ambulance. And it will look very similar to the glucometer, the glucose test that's already done for stroke patients. We'll kind of tack this on to that glucose testing. And our hope is that this will get those patients to either the right facility or the right team up to 6 times faster than the current standard. So when we created the company, actually, it's an interesting, I've had a lot of people ask me, how did you start this? I mean, what was happening when I was at WVU is getting a lot of other companies interested in licensing my technology. So the technology I'd created here was issued patent, and I have a few other provisionals. But I had some folks that were coming to me and say, we want to license this, and we want to work with you. And I was ready to do that. Our grants manager at the School of Nursing, Richard Gersh, said, I know how passionate you are about this. I think you should start your own company. And he said, I know I have experience in biotech. I kind of have an idea of how to do this, and I know people we could bring in immediately. Are you in? And I said, absolutely. Let me talk to my husband first. And then came back the next day, we created, and then from that time on, really got to create our scientific advisory board. We've actually received over $3 million in funding from the state of West Virginia, as well as other investors, angel investment. We are a startup, so we are still in our angel kind of startup series phase. And many of our advisors are folks that have tried to do this in the past. So Danny Laskowitz is a scientist who actually had a company called Biostite, and they were working on a stroke triage diagnostic tool, very similar to ours. They had some issues getting through the FDA. And so we are leveraging Danny's experience to help us guide our FDA strategy. And Steve Rosenberg, who's an SAB member who was part of CardioDX's scientific advisory board. So we are really pulling together a really nice and well-rounded team to really try to make this happen. And before I go into that, we are actually launching a new phase in our company. And I was just talking to somebody about this morning. And I'm getting to the point where I'm going to have to let go on some level, because as Chief Science Officer, I'm guiding a lot of the science, and I'm also guiding discussions with the FDA. Discussions about Medicaid and Medicare reimbursement. I can learn this, I can do this, but it's going to take me a lot more time and a lot more money to get it right. And so as a leadership team, we've sat down and we've thought strategically about where our company is going in the next 12 to 18 months. And what we really need is a team that's been there, done that before, and we're kind of overseeing the vision and guiding it. So it's another lesson learned, getting ready to say, okay, I've birthed this to this point, I'm ready to let this go. It's like having children and saying, okay, I trust that this is going to work out. So it's exciting. It's really exciting times, and I'm really anxious to see where we go actually over the next 12 to 18 months. And to talk a little bit more about the science behind rest, because I think you all will be really interested in kind of the trajectory of the science. We've actually done quite a few different clinical trials now, some of which we started when we were here at NIH, many of which we conducted when we were at WVU, and now as a company, we are supporting clinical trial work that really paint a very different picture of stroke than what we thought before. And it's different in the fact that the immune system, and not just inflammation, innate immunity, but this whole notion of adaptive immunity and antibody and the signatures of disease actually play a really critical role in not just the onset of stroke, but the progression of stroke. And we are leveraging this pattern amongst innate and adaptive immune system biomarkers in our REST test. And because we're leveraging this pattern, we can get multiple different patterns, or we can get a very generalized pattern. And the way that we are creating this for our point of care assay is multi-analyte. We actually have a 10 marker profile right now that are innate, adaptive, and some brain specific, but not primarily based on brain specific, and I'll tell you why that's important. And these patterns are against strokes, so we're actually lumping all strokes, ischemic, hemorrhagic, and TIA, for triage decisions, against stroke mimic, because that's the triage decision that's being made in the back of an ambulance. It's not ischemic versus hemorrhagic. It is this person having a stroke? Yes or no? If they're not, mimic, whole different path. If they are, they're going to stroke center. So this is the triage number one decision that we are making. Our second iteration of the test will actually determine between ischemic and hemorrhagic, and we have data to suggest that we can do that. Completely different end users, completely different intended use. We're now talking about treatment. We're thinking about this for treatment. So to get through the FDA, because there is no precedent set, we are going through with low risk, de novo, 510K application, stroke, yes, no. And then we can start doing these other things as we get through the FDA and set a precedent. And why we're not leveraging completely brain-specific peptides is really important. And we get asked this question a lot because there's a lot going on with concussion and head injury based on these brain-specific peptides. The problem with stroke is that most strokes are relatively mild, which means that the injuries are not that severe. And these brain-specific peptides are at such low expression that if we wanted to detect them with a point-of-care technology, we currently don't have those technologies in existence. So we have to leverage something else other than these brain-specific peptides that's going to give us some signature of that disease. And that's where this crosstalk between innate and adaptive immune system biomarkers comes in, and the pattern of expression. So we're not just looking at 10 different biomarkers. So historically, we'll say multi-analyte biomarker assays have been biomarker 1, biomarker 2, some kind of regression analysis to understand how this biomarker looks against this biomarker. We're not doing that. We are doing a sophisticated form of pattern recognition where we're actually looking at the relationships amongst the biomarkers themselves and, sorry, I was trying to time myself because I often go over time. So the pattern amongst these biomarkers as well as amongst the conditions. And we've now shown that this works in 3 different independent cohorts with levels of sensitivity and specificity that are far behind what we're currently doing in clinical practice. The problem, however, is not the science. The problem is that there are no point-of-care devices that can quickly assay RNA transcripts in a whole blood sample at the point of care. So when we went to create the company, scientist in me, thought this is great. We have a biomarker profile. It has great sensitivity and specificity. Let's do this. Spent about a year looking for technologies, came out of this saying, oh, wow, there are no technologies out there to do this. So now what do? We have to think about this differently. So now we're translating all of that work to a protein assay that can actually be detected at the point of care. Still working on the transcriptomic assay in the hopes that some technology one of these days will pop up. Or I was talking to somebody earlier, we may create something, who knows. But this was something I was not expecting as we came into the company. And it's something that we've now put a lot of effort and energy into because it is important or else we're never going to get there. And we have an enabling technology company that we're currently negotiating relationships with who can do both of these, but the RNA transcriptomic work is nowhere near through the FDA. So we want to make sure that we're going to get through the FDA quickly in a time-efficient manner. And I have anybody who wants to talk to me about that, I would love to talk more about that. The next 12 to 18 months for us are FDA getting through these preclinical studies, really creating this prototype, raising the money that we need to do the trials and the reimbursement studies. And we probably have about a 5 to 7 year timeline if we look at everything that we need to do to get through. And our intellectual property covers the spectrum of stroke care, and it actually allows us to not just work on this triage problem as a triage diagnostic, but we also have a pipeline of products that we're thinking about creating for future recovery, treatment, and monitoring. So our VALIS trial right now is about halfway done. University of Cincinnati and the University of Texas, Austin. Our goal is to complete that. We had a conversation with the FDA pre-submission meeting that went fantastically. Goal is to go back to the FDA, just talk to them, continue to explain what we're doing, get some guidance there, and obviously complete our negotiations with our enabling technology company, because that enabling technology partner is critical to our success. If they can't get through the FDA with their technology, we're not going to get through the FDA with our test. And so we were really choosing a technology partner who's far enough along that they're less risk, but also willing to co-create with us in the interim. And so that leads me to the last part of the conversation, which is all of this experience taken together. And what I have noticed is that my personal life has really collided with my professional life. So I'm telling you all about this Valtari experience. This was as I was recovering from my heart attack. With a new baby, I have a clotting disorder. So I was doing this and recovering at the same time. And I had a really, really hard time. There was a time where I wasn't coming back to work. And I said, I'm giving this all up. I just want to be a stay-at-home mom. I cannot do this. and this career at the same time. And I was part of the Robert Wood Johnson program at the time, and I had a fantastic group of mentors who really helped me get through. And what I recognized was that I was a nurse. I did not know how to take care of myself. I did not know how to navigate this world and recover well enough to continue to be a leader in my academic environment and in my business. And I said, who else is struggling with this? What I have inevitably begun is there are a lot of people who are struggling with this. A lot of folks who have had these chronic illnesses who have to go back to leadership positions, who are going back to their home and work and life communities and their environments. And not only are they working on this leadership game, they're also recovering in a way that allows them to balance. And that is why I created Deep Roots Healing. And Deep Roots Healing is really this clash between my personal and professional transformation. Because those of you who know me, I talk about my life now before my heart attack and after my heart attack. Everything's kind of defined in this way because I now approach life very differently. And my mission really is to inspire and educate and to find those who have had these experiences, who are transitioning back into life and work roles, and who need support and guidance to do that. And I will leave you with this slide because this is the slide that really prompted me to create Valtari, that really prompted me to create Deep Roots Healing. And it was in a session at my Robert Wood Johnson training, and Jackie Campbell was in the front of the room, and she said, create your legacy. What do you want to be known for? Write that down. Go straight to the top, write it down. And then the next question was, are you taking steps to do that today? The answer to that is no. Then you need to rethink what you're doing on your daily schedule. If the answer to that is yes, great, you've got this figured out. The answer to that for me was no. And I thought, whoa, wow, okay, I need to be working on this today. And that's really now how I live my life and how I create my science, how I think about my company, how I think about what I'm doing. It's no longer just to fit the box and these are things that I should be doing. It's really things that I need to be doing to create this legacy I want to create. So with that, I would love if you all have questions. I don't know if we have time for questions or if...
Yes, we have time for a couple
of
questions.
Great. So thank you all very much for listening to my story, my journey. So it's never a good thing when you don't get questions. So, or maybe even comments. Oh, thank you. Thank you. Most people don't expect to hear that story from me when they see me. So I normally get this, what happened? So I appreciate that. Thank you. Thank you.
I specifically appreciate you presenting the journey toward creating your own company, how to move forward with that. We are still always looking for, and not speaking specifically to you, but this is an entree for me to talk about the SBIR programs and that we are always looking for excellent applications to come in for that. So some of us forget that that's a part of our portfolio and that there is a % of actual funding that goes to supporting that part of the portfolio. Keep that in mind as well.
Yes.
Thank you.
You're very welcome. Since you opened the door to that, I will say, where we were speaking earlier, there just aren't enough of us nurses doing this kind of work. And, I've talked to many of them who, immediately when you say I'm an entrepreneur, there is kind of this negative connotation associated with it at times, all these conflicts and all of these things. And so there's really an opportunity, I believe, for us in nursing to really lead the way in terms of training, because we don't prepare our nurses to be entrepreneurs, nor do we prepare them really how to be leaders and managers for their own labs, for that matter. So there's a lot that we can do, I think, to mentor.
Thank you very much.
Thank you all very much.